This is Fox 5 News at 10.
Imagine having a mini stroke at just 26 years old. It happened to a former TV star, and could it happen to you? A doctor joins us with some of the symptoms and the warning signs still ahead tonight. Actor Frankie Muniz just turned 27 years old. Last week, he had a mini stroke. Muniz, you may remember, starred in the hit TV show Malcolm in the Middle. Following his stroke, his friends noticed he wasn't speaking well and he was having trouble understanding them. So could you be at risk for one of these mini strokes? Dr. Alexander Dromerick from the MedStar National Rehabilitation and Georgetown University Hospital joins us. Thanks so much for being here.
Pleasure.
When we hear or think about someone having a stroke, I'm thinking about someone who's older, maybe over the age of 50. This happened when he was just 26 years old. So it concerns me. Who is at risk for a mini stroke?
Well, we can all be at risk for a mini stroke. People who are overweight, have high blood pressure, who have diabetes, who smoke, have high cholesterol are certainly at risk for a stroke. In the case of somebody who's 27, there's usually something unusual going on. They may have an inherited condition, or they may have very severe high blood pressure. And in general, these things can be picked up by routine medical exams.
Let me ask you, what are the warning signs? I mean, you know, as we go about our daily life, should there be things that we should be looking for?
Great question. So sudden onset headache like you've never had before, sudden change in vision, double vision or trouble seeing, sudden weakness on one side, sudden trouble talking. The common theme in all of this is sudden. It's a stroke out of the blue that occurs within a couple of minutes. It's not something that comes on over weeks or months. It's something that happens very suddenly over a few seconds or a few minutes.
And when it happens, I'm assuming we should immediately go to the hospital. Is there a way to recover from this once it happens?
Great question. So you should immediately call 911. Do not drive to the hospital. Do not call your doctor. Do not call your spouse or your mom. Call 911 and get to the hospital. There are two reasons. One is because you don't know if the stroke is going to get a lot worse and you may not be able to walk or drive to the hospital. The second thing is that we have clot-busting drugs that work within 3 hours of the onset of the stroke symptoms. So if you're in the hospital and diagnosed within either 3 or 4.5 hours after the beginning of your stroke symptoms, we have treatments to help you. After that, the window closes, becomes much harder to treat the stroke symptoms.
And last but not least, is there any way to prevent a mini stroke?
The biggest thing to do is to watch your blood pressure, if you have diabetes, to manage that very tightly, to not smoke, and to make sure that your cholesterol level is normal.
All right. Dr. Alexander Dromerick from MedStar National Rehabilitation and Georgetown University Hospital. Thanks for coming in tonight.
My pleasure.